dental implant cost. What affects the cost of a dental implant procedure?
So we get asked that question all the time. Get asked on the phone, get asked in person in a consult. And I tried to narrow it down to about 9 different factors that affect the cost of the dental implant. One is the implant itself. There are probably 200-300 different implant manufacturing companies. They all make implants. Some are FDA approved, some are not FDA approved. The implant itself costs us anywhere from $400 to $1,200.
Okay.
So that's one of the things that affect the cost. Now, when me and my friends sometimes watch these commercials or see the commercials of doctors advertising, come get an implant for $500 or for $1,000.
Like on Google, we see that.
Yes, all the time, on billboards, on Google. It's misleading, Randy, because they're just talking about cost of placing that titanium post into your jaw bone.
Interesting, okay.
They're not talking about all the other costs that comes with it. What goes on top of that implant? What else is
Do you think it's misleading?
Oh, absolutely it's misleading. And if they're misleading you from the get-go about that, what else are they misleading you about, right? Doctors involved. Most offices, it's still done that way. It's been done that way for decades now. You have to go to one office to get a scan. You go to another office that will do the surgery. You go to the third office that will place your teeth. Well, it's inefficient. Everybody is doing just one part of the total treatment. Well, in our office, you come in and everything from A to Z is done in our office. We design your smile, we do the scan in our office, we are the ones doing the surgery, we are the ones that are placing teeth in your mouth, so we're able to cut on the cost. If it's more efficient to us, we're able to pass it to the patient. Surgery needed. Some people come in with no teeth at all. Then all they need is implant placement and then teeth that go on top of those implants. But not everybody's like that. Some people have no bone, some people need extractions. All of those things affect the cost. Bone grafting, sometimes you have to add the bone into the sinus, you have to extract multiple teeth, you have to level the bone. There are many factors that are involved in that. The big lab bill. Technology changes everything. Everything's digitized now. Having your own in-house lab helps you cut down the cost. Ability to print your own teeth helps you cut down the cost. So if we can cut down on the cost, we're able to pass it savings onto our patients. Insurance is another big one that patients ask us about.
How much does insurance cover?
Look, the best insurance in the world will cover $1,000 to $2,000 a year. That doesn't even come close to what the total cost of replacing a full arch of teeth is.
What about Medicare or Medicaid?
Medicare and Medicaid, 90% of cases, they do not cover this kind of procedure. They're designed to give you the least expensive alternative. They just want to get teeth in your mouth. It doesn't matter how it feels or how it looks. So for majority of patients, it's very, very small portion of what overall treatment. And we maximize the insurance. Every little bit helps. If we can maximize it for you, we absolutely will.
Do you have payment plans?
We have payment plans, and that's how majority of people are able to afford it. Those payment plans are customized to your monthly budget, what you can afford, and that's how you go about it. Materials. That is a big part of the cost. There are teeth that are plastic that go on top of these implants. There are teeth that are acrylic that go on top of these implants. We try to work with the best materials, strongest materials, so you can chew whatever you want, so it can last you for the rest of your lifetime. So obviously the cost for those will be higher. The warranty and maintenance. A lot of dental offices just don't talk about it. A lot of dental offices don't do it. They just want to do the procedure and then you have to go and maintain it somewhere else. Well, we like to maintain what we do. We give warranty. We give 5-year warranty on all the work that we do. Obviously, we ask patients to maintain it because it's a big part of keeping yourself healthy and keeping what we gave you in good working condition. But maintenance and warranty is another part that affects the treatment. And probably last but not least, experience and training, right? Who does your procedure matters. Now, we all started somewhere. So At some point, I was the one who was doing my first implant or my 10th implant, but now I'm doing my 10,000th implant or whatever number that is. Experience of the doctor, the training that they have, the number of cases they did, there is no substitute for that.
So when they call your office and they say, how much are dental implants? I guess it's not that easy.
No, it's not easy, and it's actually one of the things.
So the catch is they got to come in.
Yeah, catch is they got to come in, and then we'll talk about all of those things.
So you give them a price right away when they get there?
Yes, they
How
will
soon
leave the office.
from the time they get there can you tell them you'd be a candidate? You could do it. That same day?
Yeah, that same day.
Okay.
That same day. We'll talk about your priorities first. We'll talk about what do you expect. How do you see yourself in the end of this treatment? Let's forget about where you are. Let's talk about where you want to be. Once you tell me that, then I can give you the price.